Hello everyone. So again today we are here with a new patient with a new clinical sign that will be useful for all of us in the long run for every patient. So we are very familiar with the term of heart failure, which probably we will be seeing throughout our life in our OPDs when we become doctors. So today I have came across a very important sign for you all as students, as doctors, and that is called as the hepatojugular reflux. Now hepatojugular reflux is very specific for certain conditions, especially right ventricular failure. So when the patient comes with minimal signs of right ventricular failure and you are not clear whether the patient fits in as a case of heart failure or not, you can do this hepatojugular reflux test to see for the rise in the jugular venous pulse, which can be evident clinically. So we have this patient who has presented to us yesterday with all signs of heart failure, but he didn't have the classical pedal edema. Now it has decreased because we are giving him some diuretics and he has improved drastically. But today also he has basal creps, he has palpable liver, so he was fitting in clinically in as a case of heart failure, but with minimal symptoms. So what did I do? I did the hepatojugular reflux to see that there is a rise in the JVP with the procedure and the maneuver, and that helped me arriving at the diagnosis. So what is hepatojugular reflux? Hepatojugular reflux is when you apply pressure to the upper part of the abdomen near the liver, which is the right hypochondrium. You press it with the fist for 10 seconds and you see now the JVP is getting raised, or it has risen. So this should rise more than 3 centimeter to be labeled as positive. Now it has gone. See, again I will give a pressure for 10 seconds and again the JVP has raised. So we can clearly see that the jugular venous pressure is rising and falling when we are, and when I have released the pressure, the jugular venous pressure has gone. Why this happens? Because if I press the right hypochondrium of a normal patient, the heart is competent enough. What does this pressing do? Does this pressure on the right hypochondrium causes a venous return that increases, means more blood goes to the right side of the heart. For a normal heart, this rise in the venous return is not a problem. It will pump the whole rise of the volume that has come and the JVP will not be raised. But when the heart is ill, when the heart is failing, it cannot cope up with this increased venous return on the right side of the heart, as a result of which we see this rise in the JVP. So with minimum heart failure, you can do this hepatojugular reflux for at least 10 seconds and you can see that the JVP is rising. This hepatojugular reflux is very specific for constrictive pericarditis, for right ventricular infarction, and for restrictive cardiomyopathy and right ventricular failure. Some book says it is also specific for left ventricular failure, but only when the pulmonary capillary wedge pressure goes above 15 millimeters of mercury. So on daily basis you have to do this test, because this positive hepatojugular reflux has been found to be associated with increased morbidity and increased mortality in patients of heart failure. So with minimum clinical cardiac failure signs, you do this hepatojugular reflex, press it for 10 seconds. Some books say 15 seconds, but we will stick to 10 seconds. Press it for 10 seconds. You will see a rise in the JVP more than 3 centimeters, as I have seen. I will show it once again before I end this lecture. So if this becomes positive, the patient is in the patient is in cardiac failure, and you can treat the patients accordingly. This is important because it is not necessary that we have all the investigation facilities everywhere around the world. So in remote places where you are dependent on your clinical acumen, you can do this test to see that the patient is in cardiac failure and then treat the patient like we did in this patient, and the patient has improved drastically. He was having coarse crepitations, he was breathless, he was having some edema also, but that has all gone. But what is remaining? The positive hepatojugular reflux, which is indicating that the patient had clinical cardiac failure and has improved with diuretics. So let us finally see this hepatojugular reflux once again to revise, and then we will end the lecture. So this is the patient with not that much raised JVP. It is near normal, and when I give pressure to the right hypochondrium for 10 seconds, automatically the JVP has raised. significantly. So this is a positive hepatojugular reflux. So go back home, go to the literature, what I have taught today in hepatojugular reflux, read from the books again, so that this thing remains in your mind for the rest of your life. Thank you for your patient watching. मेरे 15,000 फॉलोअर्स है.